Welcome to Toledo Clinic TV. Our guest for this segment is Dr. Timothy Kasunic, and you specialize in immunotherapy for cancer treatment. Explain what that is.
So in the past, we've used chemotherapy to fight cancer, and chemotherapy I call throwing the baby out with the bathwater. So chemotherapy works by attacking rapidly dividing cells in the body. Now, cancer cells are the most rapidly dividing, but you get the side effects of chemotherapy because it attacks the blood cells, the hair cells, the linings of the mucous membrane, the nerve cells. So the side effects are nausea and vomiting, hair loss, lowering of blood counts, which can lead to infections. So in the last several years, we've looked at targeted therapy. We've looked at how can we look at the biology of the cancer and look at the DNA differences in cancer and exploit that. But we haven't been able to manipulate the immune system, at least until now.
And so how do you do that?
Well, how does the immune system work? The immune system works by attacking anything foreign to the body. So we usually think of bacterial infections, viral infections. When the body sees them, the immune system attacks because they know they shouldn't be here. But why doesn't the immune system attack cancer cells? So cancer cells have on it a protein called PD-L1. This acts as a disguise for the cancer cells.
So the body doesn't attack it?
The body doesn't see it as foreign. They don't even see the cancer cells there as being bad, and so they're ignored.
And so how do you know how to target specific cancers?
So scientists finally came up and found this protein, PD-L1. This protein, PD-L1, is on the surface of cancer cells, acts as a disguise. What they did was came up with a molecule called a PD-L1 inhibitor. That PD-L1 inhibitor attacks that protein, takes it off the cancer cells, and now the immune system can see the cancer cells, and the T cells of the immune system attack it and kill it.
So you're using the body's own immune system to fight off the cancer?
That's exactly right.
Okay, that's the simplest way to explain it then.
Absolutely.
So are there specific drugs then that you would use in addition to that?
Well, it's a good question. Right now, immune therapy, these drugs called checkpoint inhibitors that attack the PD-L1, they're being used, first approved in melanoma, which is a very aggressive skin cancer. Now they're approved also in lung cancer, in kidney cancer, in bladder cancer, in head and neck cancers, in Hodgkin's lymphoma, and they're in clinical studies in many other cancers.
And so are you finding that this type of therapy is as effective or even more so than traditional chemotherapy?
Well, the biggest success so far has been in melanoma, this aggressive skin cancer. We've taken this type of immune therapy and combined it with another type of immune therapy, and that dual therapy has resulted in cures in patients with metastatic disease.
And so the success rate is huge.
Well, the potential for success is huge. Now, not everybody responds, but many, many people respond to immune therapy, and some people are in fact cured from it.
And how do you know when to use that type of therapy and when to do a more traditional route?
Well, some of this is dictated by how the drug was approved. So everything that we use in cancer has been put through a study. And that study takes maybe 1,000 people, they get one treatment, and 1,000 people, they get the other. And based on the results of that study, we determine what's the best way to approach that patient at that point in their cancer treatment.
It's very nice that you can sort of tailor the treatment to each individual patient then.
Cancer has evolved into a much more individualized approach. So the more we learn about the pathways that the cancer acts in, the more we learn about the biology of the cancer, the more we can target the treatment to the individual person's cancer rather than treating everybody the same.
And ideally do away with a lot of the side effects.
That's the hope, because it's tough enough having cancer, but then when you have to deal with the cancer and then deal with the treatment side effects, it can be horrific to people. So if we can get to the point where we're targeting the cancer pathway without targeting the rest of their good body parts, then it would be really, really successful.
Okay, thank you so much for joining us.
Oh, it's my pleasure. Thank you for having me.
We'll be right back.